many, many years ago, I worked with a woman who, when she came to see me, told me that her mother had a piece of rubber hose about that long, and she would pistol whip her with that thing when she was 8, 9, 10, and she would be a bloody little mess by the time she got done with her. And her sister confirmed this. Her sister told me, "Well, she's not making anything up. I watch this at times." So, so her mother would beat her. So on the last therapy session I had with her, and she was doing better, a lot better. But she said, Bill, she said, when I first came to see you and I told you about my mom beating me, she said, I wouldn't even get to the car in the parking lot before I talked myself out of that I was making too much out of nothing, that I was exaggerating, that I was feeling sorry for myself, all this stuff. She says, it took me weeks, if not months, before I began to realize that I had a right to talk about it. I wasn't making anything up. I wasn't exaggerating. I wasn't overstating it, anything like that. She said, it took me a long time. And so ever since then, I thought, if somebody that has been abused that dramatically has trouble making it real, what about people where it's more subtle? Where it's not so much what happened to me, or what was done to me, but what didn't happen? What about those folks? They really have a hard time.
Welcome everyone. Today we have an incredible guest who I am so excited to talk to. I'm excited for those of you who are going to hear him speak for the first time. He has 50 plus years of experience in the mental health field, and he's helped hundreds of people in his private practice. However, he didn't just stop there. He also became a TikTok all-star, accumulating nearly 500,000 followers by sharing his free, in-depth, and profound wisdom from his experiences that has helped so many people online, including myself. So with that, please welcome Bill Munro. Bill, how are you?
Just great. Thank you. I appreciate your invite.
Thank you so much for joining us. I think you have just a wealth of knowledge that so many people, and I know you've seen it on your TikToks, just thank you so much. And I thank you from the bottom of my heart as well for sharing that. So with that said, can you just share a little bit about yourself and your journey and how you became to be a mental health expert?
Sure. It was a circuitous journey, if you will. As it is so often, I have ADHD. And I got out of University of Iowa and didn't know what I wanted to do. And I got a job at a bank in trust administration. And I think I lasted there about 3 years and just was dying there. I just hated it. And so I was out on a date. I was single then. I was on a date, and this gal was telling me about being a, quote, social worker. She was a bachelor's degree social worker, and she had probably the most difficult, in some ways, the awfulest job in social work at the time in protective services. And it involves removing kids from their homes and dealing with abusive parents and all this. So she was telling me about this one night. We're parked, and God, when she started telling me what she did, I just felt this kind of feeling in my gut that I haven't, you just don't have until it's something like, wow. And I wanted to do it. Right there, I knew I wanted to do something like this at least. And so, and she was telling me how I could get a grant from the state of Iowa, go to graduate school, they would pay my way, and so forth. Well, that's what I did. I quit the bank within 6 months and took a 50% cut in salary to work for the state of Iowa in social work for a couple of years. And then went to graduate school at the University of Nebraska in Lincoln. And really didn't know I was going to become a psychotherapist, but that's where I started leaning towards that. And so after graduation, I started work as a chief social worker in a gigantic, back then they were gigantic mental institutes, if you will, and met a great psychiatrist, Gary Brooks, who became a very close friend of mine. And he was very supportive, and I started doing psychotherapy, and I never stopped. I've done it ever since. And Gary and I both, about 1975, probably 75, we began really getting into ADHD. Except back then it wasn't called ADHD; it was called minimal brain dysfunction. And hyperactivity and minimal brain dysfunction were kind of seen as separate. And then in the 80s, that was brought together, and the new name of ADHD was implemented. But ever since then, I've worked with it, and then had a great experience with Martin Wetzel, who was a psychiatrist about 10 years ago. For about 10 years, he and I worked together and referred back and forth. And he was a huge influence as well. So I had some wonderful people in my career that gave me a great deal and taught me a lot. And so that's kind of how I got to where I do today. And I've been in private practice since '89 and been in Omaha here, Omaha, Nebraska. So,
That's fascinating. So you started doing a job that you weren't very interested in, and then kind of by
like
chance.
so, like so many people with ADHD, because if you have ADHD and you get in the wrong career track, it's really bad. So finding that thing that works for you is so important. And I was just incredibly fortunate to have this date with this woman who kind of introduced me to this whole kind of, I don't know what would happen to me if I hadn't met her.
That is
Yeah.
wildly fascinating that you kind of fell into it that way, and then now here we are 50 years later,
Yeah.
and you're
Yeah.
still doing the same thing. So you must really love it.
Yeah, I'm passionate about it. Yeah, I enjoy it.
So for someone like myself who's not very well versed in ADHD and ADD, can you kind of dive into what that is all about and kind of what it's like having it and the diagnosis and treatment of it?
Yeah, yeah. Um, it's a, in my opinion, it's not a psychological problem. It's not a psychiatric problem, even though it kind of falls under that. Psychiatrists seem to be the ones that often will be the ones that will diagnose it, but not always. Uh, I think that it's a neurological issue. It's a neurological disorder, if you will, but and it involves most likely it seems to be, as we understand it now, the executive system of the prefrontal cortex of the brain. It's kind of compromised in some ways. And as a result of that, things like focusing and this emotional regulation, um, procrastination, concentration, um, all of those things become really, really difficult. So, and there's two types of ADHD. There's hyperactive type that you often see in boys and children in that. But the majority of people that have ADD have inattentive type. And you rarely see adults with hyperactive type. But I think commonly in the culture, people think of the hyperactive thing. And so if you see somebody that is really bright and has inattentive type and is getting really good grades, nobody would ever suspect they have ADHD. But many times that's exactly what's going on, except nobody knows it because they perform pretty well and you wouldn't expect it, and they're not bouncing off the walls. So those people usually will get diagnosed later. Kids with hyperactivity, they'll get diagnosed early because they're a real nuisance, and teachers and parents struggle with them.
Yeah, and kind of what you just described kind of sounds like me and a lot of my friends, right? Procrastination, not having good attention, switching from a lot of things, and I think technology might play into some of that. Correct me if I'm wrong, if I'm stepping over bounds here, but is it something that can develop, or is it something that you're just kind of born with? And with this era of technology where we're constantly changing our focus, is that helping or hurting?
Um, that's a great question, and it's kind of the one that's being asked today, about it, because my feeling is that I think there's plenty of science, good science, that tells us that it's the most heritable disorder there is. It's genetic, and it runs in families like you wouldn't believe. So I definitely think that, but I think there's also just average people that are being inundated with devices and social media, and everything lasts about half a second, you know, um, and so what's that doing to our neurotypical brains? What's that doing to the average person? We're going to find out, because this is a whole new world we're in, and we'll find out. But so you have people that have ADHD. Clearly, it's a neurological issue, and it's heritable. But then you have people that have ADD-like symptoms, but it's not the same. It's not the same. So, but yeah, I think the media and everything, technology is probably really affecting the normal brain, the neurotypical individual, in ways that we maybe not even fully understand yet.
I completely agree with you. And I think personally, just having, I'm a 28-year-old, and personally having kind of grown up in that technology era. I mean, at one point, Bill, I was a professional video game player. So I was deep into
Cool.
technology. Um,
Yeah.
I truly believe that later on in life, we may look at giving a 13-year-old a cell phone and social media, maybe the same as we did now looking at giving a 13-year-old a cigarette, maybe back in the day, just as far as what it does developmental wise. What are your
Yeah.
thoughts on something like that?
Yeah. I think we might find that out. We don't know, but at the same time, I grew up in the age of television coming into its own, and everybody thought that was going to turn us into monsters or, or juvenile delinquents or whatever. And not so much, but whatever, we'll find out.
That's true. That's true. So I want to talk about something interesting, and I want you to correct me if I'm wrong, and from your perspective. So one of the books I'm very fascinated with, I don't know if you heard of it, is Body Keeps the Score by Bessel van der Kolk. Have you read this book?
I've not only read it, I've met him a couple of times, and it's really an important book right now. There's several books that are really important right now. That's one of them, and it's really good. I recommend it to clients all the time.
That's awesome that you've met him. I would be fascinated to talk with someone like him too. I recommend it to a lot of people as well. My girlfriend actually has really bad trauma from her childhood, and I recommended
Oh
it
yeah,
to her. And just within the first 80 pages, she kind of had to stop reading it because it was that, it hit home that hard. So, to anybody out there, it is a great, tool maybe to look into. But the book brings up an idea of how young this idea of mental health is in our current system. The example that it draws on in the book is in 1917 during the First World War, when soldiers would come back with shell shock. They were told that it was just a normal part of battle casualty. And they said that shell shock should not be recorded in a hospital or medical document, saying that well trained troops that are properly led would not suffer from shell shock. It has nothing to do with mental illness, and that those who did have it were undisciplined and unwilling soldiers. So basically, that's 100 years ago, where we have no, idea of mental health. How have you seen that change, and how just crazy is it to think of it from that perspective, that we're now just diving into this idea of mental health?
yeah. It is interesting how recent it is. In so many ways. The I've had the privilege, literally the privilege, of working with World War II veterans and Korean War veterans and Vietnam veterans. I haven't worked with as many of the Afghanistan and so forth, Iraq. I don't know why, but part of it is now they debrief and treat these guys quickly, and they don't just let them go off, and come back home like they did after World War II. I can't speak to World War One, but I think the really in the 70s is when we began to realize that these veterans were really suffering, and so they set up vet centers around the country to treat these Vietnam vets who had come back and were back years, 2 years, 5 years, 10 years, and pretty soon that post-traumatic stress is coming out all kinds of ways: domestic violence, drug use, depression, suicides, all that stuff. So, but that's taught us a lot, and but the thing that I really find that Vanderkelt does a nice job in that book, as well as a book called Childhood Disrupted, which is another really must read. And they speak to the 1997 Adverse Childhood Experience Studies, and we now call them ACEs. Used to kind of limit in our vocabulary, either abuse or neglect. But now that term, adverse childhood, that adverse experience is just so broad now. Now we know that there can be really subtle things that just that will really affect that child and play itself out in our life until we deal with it. And so, but I think you're right. I think that, and that's why I think TikTok is, um, all of these venues have negatives about them. All of them do. Everything does. Television does. Radio did. um, but boy, they really serve a purpose. And this TikTok thing is really doing a lot in helping people learn a lot about things that in the way that they can learn, because it's quick, it's short. They don't have to read a book. They don't have to watch an hour-long documentary. They can boom, 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 and it's a wonderful way to learn, and especially if you have ADHD. Mental health has come a long way since I've been involved in it. It's just amazing. And one of the most important things are the medications have gotten better, but I still don't think they're anywhere close. There's too much emphasis on medication, maybe still not enough on really good psychotherapy or therapy.
I absolutely agree with you, and I'm glad you brought up the ACE study, because that was what I was going to touch on next. And if you don't mind, I just kind of want to go through what it is for those that have not yet heard about the ACE study. It stands for the Adverse Childhood Experiences, and it studies the effects of child abuse and related adverse childhood experiences as a public health problem. And it was done with the CDC and Kaiser Permanente, started in 1994, and looked at 17,000 adults. And what was shocking for me hearing about this was that 2/3 of those people reported at least one adverse childhood experience as abuse or neglect, and most of them reported having more than one. And the conclusion was that they believe they stumbled upon the gravest and most costly public health issue in the United States, which is child abuse. They calculated that its overall cost exceeded those of cancer or heart disease, and that eradicating child abuse in America would reduce the overall rate of depression by 50%, by violence and suicide by 3/4, and alcoholism by 2/3. And it proved that child abuse and neglect is the single most preventable cause of mental illness and the single most common cause of drug and alcohol abuse. So when you hear something like that, that's not really talked about that much. I mean, how profound is that? And then working as someone as yourself in that, in the thick of it, how true does that ring for you when you talk with people? And how important is this to really kind of focus on as a society?
Wow, yeah, you have your facts right there, and I so appreciate you bringing this up like you are, because it's got to be about 20 years ago that I was in Omaha, Nebraska, at a workshop, and there was probably 200 people there, psychiatrists, psychologists, social workers, nurses, and the speaker was from Philadelphia. She was probably 60 years old, expert, very nationally known expert on child abuse. And she started talking, and her first question out of her mouth was, how many of you have heard of the 1997 Adverse Childhood Experience Study? And out of that room of 200 professionals, maybe 3 people raised their hand. And
Wow.
she smiled and she said, I lecture all over the country, she said, and I ask this question everywhere I go, and I always get this response. And why the press didn't pick up on that study and why you all don't know about it, it's really something. And ever since then, I got online, looked at that study, and have used it ever since. But that's the last I heard about it. Until Vanderkelt, and then at Childhood Disrupted is a book that really captures, this woman really puts it together in a very readable way. It's not like textbook, it's really readable. So anyone should grab those 2 books and have those in their library, no matter what their background is or where they're at in their life. But that term ACE, adverse childhood experiences, that captures it so perfectly, because sometimes the adverse experience is what happened to me. I was sexually abused, or I was physically abused, or I was emotionally abused, or I had some really bad childhood illness, or an early death, but sometimes it's what doesn't happen to me. It's when people aren't there for me in the way I need them to be. You know, it's when people go away. People don't acknowledge me. People are too preoccupied doing what they do, and I'm this little kid who needs, a lot, and children need a lot, and they need a long childhood. They need a long, lingering childhood, and people that are abused or neglected or under adverse experiences, they're they grow up too fast, and their brain develops in a way you don't want to see it developing. That's a whole nother story in another book, but about that. But the most important thing, I think, is learning about adverse experiences and the effect long term. And that's what that study just is an amazing job of. Long term, the effects that our life expectancy is shortened. Our likelihood to get autoimmune disorders are greater. Relationships suck. Because we're not effective in them, because we're always in this survival mentality, and can't trust and can't tolerate intimacy. So those adverse experiences have a profound effect long term. So yeah, you're really wise in bringing that up and being as aware as you are of this. So and if you have more questions about that, I kind of got lost in all that. So if you have questions about what I just said, just shoot them to me. So
Yeah, absolutely. I think it's a good point to kind of dive into that, because you can speak more to it. But I think, early on, especially in your generation, dealt a lot more with toxic masculinity and this idea of burying down your emotions, and anything that, is a trauma, bury it down and don't bring it up. And I'm kind of excited with the idea that this is kind of now kind of being dismantled, where a lot more people are being encouraged to talk about things that may have happened in their childhood. And it could be something as simple as your mom telling you no at the grocery store when you asked for a toy or something. I think that this idea of speaking through these things that happen to us as children, we're now seeing it has real side effects as adults. You talked about it too with one of your most viral videos with the terrible 20s. Just can you talk
yeah.
about that, and why do you think that struck such a chord with so many people that are teens and 20s, and what's up with that decade?
When I put that on there, you never know kind of how people will respond to a post, when you're a creator, like that. And so that kind of blew me away that it got the response it got. But what I was trying to say there was simply that we know that the brain isn't fully developed till you're around 25, 24, 25, 26, something like that. You go into the 20s, really not having a way of really knowing who you are in the way either people expect you to know or for you to know. So you go into it kind of vulnerable, or you're rather vulnerable when you go into that age period. You're out of college usually, although that can be going on, and that's a tough one. But I think for the 20-year-old, you usually have your own expectations of yourself that now are being challenged. I am not as far along as I should be. I'm not in a relationship as it seems like everybody else is on Facebook or in Instagram or wherever. So what's going on with me? What's wrong with me? It's easy to start to really start questioning yourself. And so I often speak to people with ADHD on those posts, as you know, and those individuals particularly develop longer. It takes them longer to get into their career path. It takes them longer oftentimes to get into a really good relationship, and in a career. They usually finish their education a little bit later. And so it's really easy to start doubting yourself and thinking, well, what's wrong with me for, I'm so-and-so, everybody else has got things going and I'm sitting here. Some people have already own a home, they have all these things, but what's wrong with me? That's with people with ADD. But I think just the average neurotypical person is often struggling during that period. And you don't know it. You don't know what's normal at that age. And so you don't realize that this is a really difficult decade. People give you a pass when you're a teenager. When you're in your 30s, you're generally kind of getting into that groove a little bit as far as career and relationship. But you can really flounder easily and normally in your 20s, but you don't know it's normal.
Yeah, and again, thank you so much for making that video and the following videos after that. I know I speak for a lot of people. I mean, if you just read the comments under that terrible 20s video, it is so heartwarming to hear the reaction of people and how they felt hearing someone with your expertise and your experience say, hey, when I was 20, I had similar stuff. Because I'll be honest right now, when I was 25, I was basically suicidal. I had not had a relationship in 25 years. I felt like, hey, I'm a good looking guy. I was very successful in high school and college, graduated, top of my class. Why am I single, Bill? What's wrong with me? Right. And you just kind of get in this self-defeating narrative where you're like, well, I thought I was going to be a millionaire by 30 and have all this going on. And now here I am. And now I'm, talking to a therapist, which I truly, truly recommend anybody doing. At first, I had the toxic masculinity trait where I'm not talking to my feelings. I'm not going to go let someone else inside my brain. And it really helped me. And now I'm in a relationship of 4 years since then. So I think it's so important to talk to people, but also just, again, thank you for sharing that video, because it profoundly helped me, especially someone who's 28 right now. And I'm sure you've seen the comments in that video, the people that just it resonated with.
Yeah, yeah, yeah. I don't get a chance to look at TikTok much. I just really, really, in fact, TikTok's made me busier. So now I'm really busy. But when I do and did with that particular post, yeah, it was really amazing to me how many people were thank you so much. It was amazing how touching, like you said, so many comments were. So it really was really interesting for me, the response to that.
I want to talk about this book that I recently read. It's called Nonviolent Communication. And my mom actually gave me this book, and I didn't really know what to expect when I read it, but it was one of the greatest books I've ever read. And it talks about the idea of effective communication. And I want to ask you, as someone who, talks to people on a daily basis, the idea of how important you think just better communication training in schools and just in general can go to solving this issue that we see between parents and children, but also people in society. Because I think a large portion of therapy and talking is having that person make you feel heard, repeating back, okay, it sounds like you said that you're frustrated with your mom in regards to this. Am I hearing you correctly? And I think just that simple measure of repeating back what they said so that they feel completely understood, that there's no miscommunication, is just so powerful, just in a communication sense. How
Is
do
there
you,
a question in there?
yeah, how do you feel that alone is just so fundamental to mental health and helping people move past trauma? The idea of feeling heard, the idea of just feeling completely understood when they say something. Because I feel like, in a relationship, you hear, oh, yes, you want me to take out the trash, but you're not really hearing what they want. There's a little bit more than just, can you take out the trash, right?
Well, I'll start with this. In this kind of work that I do, when I'm doing kind of this, on Zoom lately, a lot of it's on Zoom, but in my office, it's amazing. And this is not just true with Bill Munro. It's amazing how many of us that do what I do, and including myself, it's amazing how little advice we give. It's amazing how little advice it's you do. And sometimes it's really important to be able to give somebody advice. But it's amazing to me, and I will never get over this, how powerful it is for someone to feel heard, to feel seen. Those two things, if you can't do those two things as a therapist, you're not going to be effective at all, because that's far more important than giving advice, even though that's important too. So yeah, that need, that hunger to be heard or to be seen is really strong in human beings. And oftentimes that's just not happening. It didn't start out in family. It didn't happen in my family. It didn't happen, and then often, and if it didn't happen in my family, it's less likely to happen in that next major relationship, like with a partner. And so, uh, all of this stuff, communication, understanding oneself, uh, there's so little emphasis really put on that in our schooling and our education that it's pretty sad, that we're not better prepared to be better self-therapists when we go into our 20s than we are or into our life. But yeah, that I haven't seen that book. I wrote it down, but I'd like to take a look at that. But yeah, that's, communication is so important, but there's so many things that will leave me ineffective in being able to communicate effectively. They're just, self-esteem, fear of conflict, you fear of sounding or looking dumb. There's so many things that can hold me back from taking the risk of, and then we're not taught very well to do those things, like you said. So I'll take a look at that book. Thanks.
Yeah, it's Nonviolent Communication by Marshall Rosenberg. But that's pretty profound what you just said there about how a majority of therapy is just the idea of making them feel heard and truly understood just with what they're saying. I think that is so lost on people this day and age, especially with technology and how fast we're just kind of going from one thing to the next. I wanted to talk about a statement you made in one of your videos that just, oh, I love it so much. You said the phrase, "That's not who I was, that's where I was at." And
Mm.
I think that's such a powerful way to think about growth, and a growth mindset. And how do you incorporate that into the people that you meet with on a daily basis and making sure they understand that profound statement that you said?
Yeah, yeah, that's really important for several reasons. But one is that as we're growing up, pre-adolescent, adolescence, um, really early adulthood, when we're in our around 20, 21, and then during our 20s and so forth. But any time in our life, we can make some pretty bad choices. We can really screw up. We can really be a jerk. Um, we can really act out sexually, interpersonally, legally sometimes. But whatever, um, a lot of times it's where I'm at. It's not who I am. It's where I'm at. And so people then end up feeling guilty. They're living with a lot of guilt for having gone through a period of promiscuity. You talk to women a lot of times, and that will have happened to them. And that's not who they were. It's where they were at. They were vulnerable. They were needy, maybe, or whatever. But so so I think it's really important for people to, there's a Netflix special on Daryl Hammond. I think that's his name, Daryl Hammond, who was on Saturday Night Live, and he played Trump, or no, Bill Clinton, and it's a great documentary on his life. But his psychiatrist at the end was really good. So I'm not a huge fan of psychiatrists, but he was really good. And he said some things about Daryl, because he went through hell in his life, about that kind of thing. He didn't say it exactly that way, maybe, but it was basically that, and forgiving ourselves, and appreciating that, yeah, um, I want to take responsibility for my behavior, absolutely, but I don't want to beat myself up over it either. So yeah, that's an important one.
Yeah.
I want to tie that into something. Apples and onions. It's a great metaphor, I think, and it relates to what we're talking about. An apple, if you take it and peel it, and peel the skin off, and then begin to peel the meat of the apple, you get down to a core, and the core has a structure to it. It's different fiber. You wouldn't want to eat it. It's got seeds in it, and it'll stand on its own. Um, an onion, if you peel it and you get down to the middle, there's nothing there. It's air. And so there are some people that are onions, and there are some people that are apples. Most people are apples. Most people are. But some people are onions. They have no moral core. They don't have much of a conscience. Terribly entitled. Very destructive. And so there are those individuals out there, and I don't think we do a very good job of preparing our kids for those people, and because they will take advantage of, they will abuse, they will have their way with you if they can, and those are what we call personality disorders, narcissistic personality disorders, and borderline personality disorders, some of that. And over here you've got more like most of us, normal neurotics, we got issues, but those people have a core. And so those are the ones I'm speaking to when I say, it's not who you were, it's where you were at. These people, it's who they were. This is characterological. This is who you are. Do you see the difference?
Yeah, I like that analogy a lot.
And I really do a lot of trying to get people to teach their children about this group. Because if you don't know about this group, you're vulnerable to them, and they can really, really make a mess out of a girl in high school that's, or guys, So
Yeah, I agree. And to speak to that point, I'm lately have been very obsessed with the idea of this idea that we as a society in America specifically are kind of plagued with unconscious parenting or bad parenting in the sense that to go back to the ACE study, just this idea of child abuse, whether it's emotional, mental, physical, where do we go from here? What are your thoughts on this idea of, do we have too many unconscious parents who are just having kids and not really understanding the programming they're putting into a child that's 0 to 7? I think so many people think, my child doesn't remember me saying the F bomb in front of him when he's 3 years old. He's not going to have an actual recollection of a memory when I ask him when he's 15, hey, do you remember me saying that when you were 3? But the program, the subconscious programming is in that child of everything that happens 0 to 6, whether they can remember it or not. And I think we just have a huge population of procreating parents that don't understand the fundamental importance of what they're doing to their child 0 to 7, and through that childhood area. Is this something that you can kind of see in your day-to-day practice?
Well, I don't think I will ever get over, as long as I practice, how bad some people treat their children. I will never get over that. It is pretty profound, and it's not so much income or education. Some of it is, but I think the better educated we are, the better likelihood we're going to make better choices in parenting. The more we know about psychology or children and all this stuff, but still, it's just amazing, what you hear in the office. So, yeah, but it's a lot better than it used to be. It's a lot better than it used to be, but still not nearly where we want it to be, because I don't know. It's let me share this story with you. Many years ago, I worked with a woman who, when she came to see me, told me that her mother had a piece of rubber hose about that long, and she would pistol whip her with that thing when she was 8, 9, 10, and she would be a bloody little mess by the time she got done with her. And her sister confirmed this. Her sister told me, "Bill, she's not making anything up. I watch this at times." So So her mother would beat her. So on the last therapy session I had with her, and she was doing better, a lot better. But she said, Bill, she said, when I first came to see you and I told you about my mom beating me, she said, I wouldn't even get to the car in the parking lot before I talked myself out of that I was making too much out of nothing, that I was exaggerating, that I was feeling sorry for myself, all this stuff. She says, it took me weeks, if not months, before I began to realize that I had a right to talk about it. I wasn't making anything up. I wasn't exaggerating. I wasn't overstating it, anything like that. She said, it took me a long time. And so ever since then, I thought, if somebody that has been abused that dramatically has trouble making it real, what about people where it's more subtle? Where it's not so much what happened to me, or what was done to me, but what didn't happen? What about those folks? They really have a hard time uh, feeling like they should talk about that to someone, or that it's that big of a deal. So you see what I mean? So the abuse can come in subtle forms and in dramatic forms, but it's way more common than we'd like to see.
Yeah, I agree with you, because when and I create that's a terrible event, and it just seems all too common. The more times I talk to people when their guards are down, that stuff like that has happened to people when they're a small child. It's easy for them to, have that memory, the imprint, but I understand your point to where things that didn't happen, you can't really draw that memory of, oh, this, my dad wasn't there for me then, or my mom wasn't there for me then, because you don't know what should have been. So I just think the importance of just being able to communicate to one another effectively, or even, going to see a therapist is just so important in today's age. I want to ask you one more question, kind of with what we're seeing here with COVID, and then we'll get into TikTok. As someone who talks with a lot of people about, mental health issues, what do you think is going to happen when we've now had a young generation that for 2 years has been having to be social distance, being away from humans, being taught to stay away 6 feet, wearing a mask? What do you think that's going to have an effect on later down the line when they get older?
I don't know. I really don't know. And I'm not sure anybody knows. I think we're going to find out, certainly, but um, I've lived a long life. I've never experienced anything like this. And so, yeah, it's just a weird thing that should concern all of us. And getting back to what you were alluding to earlier, just making sure we talk about this. Just talk about it. It's kind of like if there's a death in the family. Let's say you have a family and the mom dies early in her 30s or 40s, and there's kids young, yeah, or a dad dies. What that surviving parent wants to do is just make sure that's on the table. We talk about that. We bring that up during the next 10, 15, 20, 30 years. That's never something we don't talk about. It's never something that we don't really want to be asking ourselves, where'd that leave me? What was that? What was that? What did that mean to me? What did that do to me? What effect did that have on me? So the more we can talk about those, answer those questions, talk about those questions, I think the better we do. We can process almost anything if we do that, like you were saying earlier about, the book, and talking more effectively. But God, I don't know.
Yeah, it's something that I think about more often than I should, about what that effect's going to have on a generation coming here in the future. So with that, let's transition to TikTok, Bill, because you are quite the TikTok all-star. Your knowledge that you share on there is just so profound, and I can't say thank you enough. Walk us through that. How did you first discover TikTok? When did you first post? How did you first post? Do you remember your first video? What made you want to do it?
Prefacing this with the fact that there's a number of people that are doing incredibly good TikTok posts on ADHD and other issues too. I don't, follow those. I don't have the time, but some really, really good people that have and they have big numbers. So those of us who are doing this are reaching out and touching a lot of people, and I think it's just great. just great. But it was October because I wrote it down because it was just being silly. I didn't know anything about TikTok, and I had a client, a 42-year-old guy who came in and said, "Bill, have you ever take a look at TikTok?" And I says, "No, not really. I thought it was for kids." And he said, "Well, I've been looking at a few posts on ADHD," and he says they're really pretty good. And I says, "Really? I never heard of such a thing." And so it's kind of like me, but he left. And I think it was that same day that I pulled out my phone and did a 30-second post and put it on there. I don't know what I talked about or anything. And I put maybe a couple of them on there. And all of a sudden, like, boom, there's 500 people that saw it. I thought, holy cow. And so then I put a few more on. And within a week, there was like 50,000 people that had seen my videos. And I'm thinking, that's more people than I've ever seen in my whole practice. I've touched more people in 1 week than I have in all the years I've practiced. That's amazing. And I just kept putting them on there, and they resonated, with people apparently, and so that's how it got started.
Yeah, that is pretty profound with TikTok, is that anybody can start brand new and post something they're passionate about or have a lot of expertise in, and you have no idea what's going to happen and how many people are actually going to see that. I think it's so incredible.
Yeah, and then the serious-minded people that were responding, because at first, I only had a few, so I'd read the comments. I can't do that now, but I would read them and just be blown away by the responsible responses, because it's very, very rare that I've ever gotten any negative things put on there, that were ugly, but amazing.
Yeah, how can has that helped you with some of the feedback that you've gotten from some of these videos? Kind of learned more about, people in general and how their brains are functioning during this time?
Yeah, I've learned a lot from this, both doing it, taking a look at some of the responses, certainly, but the clients that have come to me because of that. I had this thing happen 3 days ago, where a guy called me and he said, "Are you Bill Munro?" And I said, "Yeah." And he says, "Tell you what," he says, "I was at M's Pub, which is a very, very well-known restaurant in Omaha." And he says, "I was having dinner there the other night, Friday night, and you were there." And I sat down, and my wife and I were sitting there, and I looked at you and I said, "Who is that guy?" I just know. I know who that guy who is. And then he said, "Oh my God, that guy's on TikTok." And he'd been watching all these videos of mine on TikTok. And he didn't know I was from Omaha. He said, "Oh my God, he lives here. I'm going to call him." So he called me, and I'm going to schedule an appointment with him. And he has ADHD. So some weird things have happened as a result of it. But people have contacted me in Abu Dhabi, the United Arab Emirates, Greece, UK, Canada a lot, and all over the United States. It's been amazing, the people I've been able to talk to that I would never have had the chance to do that. And so it really tells you how it's international, has nothing to do with race or position or nationality or religion or anything like that, obviously. But so it's been quite the, and then it's forced me to do more research and do more reading, because people will ask questions, and so the one thing about ADD, whether you are a clinical person or whether you're just somebody who has ADD, you just never stop learning about it. It is so amazing. It's just like nothing else I've worked with. So.
Wow, that is a pretty incredible story. The connection that you've had, and us two talking right now as well from TikTok. So that's pretty profound. That's incredible. Wow. What's your end goal here? Do you have an end goal with TikTok? Are you just going to keep kind of posting and seeing where it goes, or is there something more that you want out of it now that you have such a big following?
One more quick question. One more quick story.
Yeah.
I see this woman in Dubai and United Arab Emirates. Just she contacted me, and she just wanted some input, and I just suggested to her that she, because she sounded like, I said, find a psychiatrist there if you can. And I'm thinking, in that country, what's she gonna do? It's hard enough finding one here. And so she called me back. We zoomed, and she told me, she said, I found him. I found someone, and I'm going to see him. And I thought, no, I wonder who this guy is going to be. I didn't know, because you don't know because some countries, they don't treat this at all. And so she comes back and she says, oh my God, he was so good. He was in his late 30s, around 40, handsome, Arab, and just absolutely so knowledgeable about ADHD. And he just knew exactly what to do with her, put her on the right medication. And it was just amazing. And I thought, that's not amazing. I would never have thought of that in that country, or the Middle East or Europe or so.
Yeah.
So yeah, it's pretty neat.
Yeah, you just learn so much about everything that's going on. That's one of the cool things about TikTok is you are opened up to a brand new, page of information that you had no idea what was going on because it's so global, right?
I want to pay tribute to somebody. The book Driven to Distraction, and John Rady and Hallowell wrote that book, and it's a classic book, and it did more for ADHD probably than anything anybody's done as far as really getting it out there. And it's been around, I don't know how many years now. There's two different books they wrote, but Hallowell has a channel on TikTok.
Oh, really?
And I just really like the guy, and he has really got a lot to offer anybody.
Absolutely. Awesome. Well, where should people find you if they want to get in contact with you? Should they just do it on TikTok or?
Yeah, because on TikTok, I mean, I can give you my email address or whatever you want, but on TikTok, I think I have a woman that does my TikTok posts. I don't have the time to put captions on, and she puts captions on and does that stuff. So I think there's a thing there where they could reach my webpage. My webpage is williammunro.com, and my last name is spelled Munro. So williammunro.com, and is my webpage. So.
Perfect. And I'll put that all down in the video description so people can find you if they're curious, because you are a wealth of knowledge, Bill.
Well, you're basically an entrepreneur, aren't you?
I'd like to think so.
Yeah. I have such respect for entrepreneurs. When I was your age, there really, I guess there was something maybe like that, but there was nowadays, and a lot of people with ADD are entrepreneurs, really, really good. But this whole thing of entrepreneurs in this country and probably all over the world, but I just think it's so cool. When I was your age, you got a job, you held on to it for 30, 40 years, and you retired. It didn't matter whether you liked it. Didn't matter whether you liked living where your job was. You just had a job, and boom. That's kind of the way it was. And remember, I always say the 50s were the best period. They were just the greatest period, the 50s. If you were white, if you were straight, and if you were, what's the other one?
A male.
Male, thank you. Thank you. Yeah, if you're a guy, if you're a male, yeah. It was a great time if you're that.
Yeah.
But short of that, it was an awful time in so many ways for so many people. And so the ability to do what you want to do these days and do it where you want to do it, and not be stuck in some damn cubicle or office, and be able to change careers and jobs in midstream. It's just amazing. I think it's just amazing.
Yeah, we have that's one thing that I do try and make sure everyone understands. Yes, there's a lot of depression and anxiety because we're always comparing ourselves to someone who's our age or younger. But in this time of age, we can start a business from our cell phone sitting on our couch. You know, if we don't like a job, we
Yeah.
can actively kind of do something to change it. Whereas, like you said, a little bit further back, you kind of were screwed based on where you lived and the jobs that were available to you there. So yeah, it's a crazy time. It is
Absolutely.
definitely a wild time to be alive. Um, but Bill, thank you so much for jumping online. I don't want to take any more of your time. I really appreciate you sharing your wisdom and continuing to do so on TikTok. I know so many people get so much value out of it, myself included. So, you know, as a big thank you from them and myself, thank you so much.
Well, I've been interviewed a number of times, over the years, but you're good. You really did a nice job today, and I really appreciated the questions you asked me. So it was really nice being here.
Thank you so much. It's nice meeting you. And with that, I will let you get back to changing people's lives out there in Omaha.
Okay. Okay. Thank you much. Bye.
All right.